The story about Mr. Siemens is interesting, very interesting. Mr. Siemens first had a hip problem when he was in the military, he was in the Navy. They x-rayed him. He had a condition called a giant cell tumor of the upper end of his right hip. He ultimately wound up with a hip replacement at that time, and so this is going back probably 30 years. The first hip replacement he had actually failed relatively quickly, and he ultimately went back in a year later and had a revision hip replacement with an older type of tumor prosthesis to replace the entire upper end of his thigh bone. He did very well with that, and did well with that for a number of years.
Well, I'd had a lot of hip replacements, the right side, and Dr. Pond had joined the Arlington Orthopedic group. And my surgeon ended up retiring a couple of years later, and that's where I got connected with Dr. Pond.
I get this phone call from the emergency room in Comanche, Texas, where Mr. Siemens lives. I said, well, I'm getting ready to go on vacation, so I'm out of the office next week. I can't do it.
He referred me to another doctor, and I refused to go because I knew Dr. Pond and I trust him wholeheartedly. He told me, he goes, I'm gonna fix your limp when I fix your leg. But to get the hip in, every doctor had told me that I would have to have my knee replaced because I'd had so many, the rod was driven right down on my knee. Dr. Pond put in a 6-inch bone graft to support that so I could keep my knee.
We did a revision procedure where we had to put a new thigh bone component in there. So we had to take the old one out and put a new one in. And he ended up doing very well with that. I mean, did great.
I was in the hospital 3 days, and I walked out on an artificial hip. I've never done that before. Today, my life is so much better. I don't have the limp. I think I'm golden compared to what I should be like. I have to stay on my feet because we had an old saying in the Navy, if you rest, you rust. And I'm too young to be rusting.